Welcome of you, and this is the third session, which is about the lumbar spine and pelvic control. In upcoming months, I'm going to take advanced spine movement rehabilitation session. If you are interested, you just send me the message. Or lumbar spine and pelvic control, where we will shift our perspective from localized structural repair to integrated movement system resilience. The traditional approach often focus on fixing the low back pain as an which people consider as an isolated structure. But from the research and clinical experience that demonstrate that the low back pain is rarely a tissue specific failures. It is an emergent property of an compressive movement system. So from the movement map ecosystem, a comprehensive framework that examines the five critical domains that we are going to discuss about the motion, axis, power, adaptation, and the perception. We will challenge the paradigm shift from the traditional exercise point of view, from the how you can check or how you can look at the dynamic pain. So for the movement map framework, these slides introduce about the foundation paradigm shift of the movement map framework. That it gives the excellent effectiveness for the rehabilitation that must transfer from the traditional to the some different perspective. We must view the patient's low back pain as a symptoms of a broader failure within the entire movement system. The transformation aspect is the key here, and that requires the clinician to move from the mindset of a structural repair to one of the fostering systemic resilience. We must look from the motion perspective, axis perspective, what are the power chain, what is the perception, the person is into the catastrophizing phase, that all things needs to be considered. This is not about the simply healing a disc or a muscles. It is about to re-educating the entire kinetic chain, and which gives the proper movement efficiency. The compromise movement system that suggests that the injury is merely the final straw in a long history of a compensatory movement pattern. When the person suffers with the back pain, it definitely shows some compensation. So we need to identify from where the person is moving. This means that we need to prioritizing the functional task like learn squat, and we need to understand about the gait also. Our goal is to create a robust system where the lumbar spine is no longer the weakest link. Why the person develops the lumbar pain, whether he has a pain or dysfunction in hip joint, or he has some other contribution, whether he has an ankle issue or in the knee issue. So this movement map it concept that highlights that the low pain is a complex emergent property. It is not a simple structural failure, as I told previously. We need to understand about the motion, axis, power, adaptation, and perception when all five are functionally optimally works and which protect the lumbar spine. When the golfers is start moving the swing, in the picture there is a rotation of thoracic waist, then rotation of the hip joint. If one of the restriction that you can find out in your patient, if the person is plays a goal, then you need to address that. When all these five are functionally optimally, the lumbar spine is protected. However, if there is one deficit in one area, such as power generation or a perceptual awareness, the entire system becomes compensated and it becomes compromised. And the lumbar spine works as a vulnerable weakest link. So this perspective focus us to look beyond the area of pain to identify the root cause. When a patient presents with a low back pain, that you should evaluate each of the 5 domains of the movement map. Is the patient's motion limited? Is their axis rotation faulty? Whether the power generation, during the generation, how the patient absorbs the force. This multi-domain assessment prevents you from the failing into the trap of a single diagnosis like a weak glutes, and that allows you to create a far more specific and effective treatment plan. For an example, the patients with the fear of bending, which might have a perception deficit, which must be addressed within the graded exposure of an exercise, not for the core perspective. The other things that we need to understand about the force wave as well as the force bottleneck. The sagittal plane movement ratio between the trunk as well as the pelvis during the forward bending, which is about the 2:1 rule. 2 degree of lumbar flexion for every 1 degree of hip flexion. Sometimes this is an oversimplification that ignores the body's ability to dynamically share the load. The movement load is distributed, that is based on the immediate capacity of the each joint. A hip with full pain-free range can take a greater shear force, while the restricted hip, as you can see in the left hand side, the red signs, the lumbar spine gets compensated. The restriction of the hip joint will force the lumbar spine to compensate and more force. From education perspective, finger assess not for the specific perfection. Observe the quality of a movement. Does the patient initiate a squat or bend from the hip joint, like a hip strategy or the knee strategy? Your job is to identify whether the movement is bottleneck is and address the joint that is failing to contribute if the person has a lack of inflection. So you must assess and treat all these 3 planes of motion because the body dimension. The person may have a acceptable sagittal plane motion, but he completely unable to control the frontal as well as the transverse plane. As soon as you ask the patient to stand on single leg, he leans on either side. So in such case, we must understand the movement compensation, which movement that triggers the pain. The ideal axis is vertical line passing through the femoral head, allowing the pelvis and trunk to stay level. If the hip cannot control the in a frontal plane, the system fails. And to prevent failing, the lumbar spine must side bend to drag the center of mass back to over the foot, which